NCLEX Jeopardy live. All right. All right. I'm gonna give you guys some time to enter the room. While you guys are entering the room, I'm going to put up what we're playing. Happy Thursday, everybody. I just want to make sure y'all can see me and hear me, right? Hold on one second. I'm gonna put up the screen. Background. No, green screen. Okay, I'm gonna put up the screen of what we're doing so you guys literally know what we're doing. All right, hold on. Pay no mind to Molly's over here. Sure, this one. All right. Hey, y'all, hey. Hey, y'all, hey. All right, guys, so welcome to NCLEX Jeopardy Thursdays. All right, I am Nurse Sam, your host, have been for like 2 years. I am the CEO of Nurse Sam Global Media, and I have been doing NCLEX Jeopardy for about 2 to 3 years. About 2 years, almost like weekly, and that alone has helped hundreds, probably thousands at this point, of RN and LPN students graduate nursing school, pass their NCLEX to get their license in whatever state. Okay, it's just a wonderful and a less overwhelming, it's definitely more fun. It's a way to review your NCLEX style questions without it just being so overwhelming and daunting and intimidating. So we're just gonna play it in Jeopardy style. All right, so y'all remember the show Jeopardy? I don't know if you've watched it, but you get the idea, get the gist. It's a game show. All right, it's a game show for NCLEX questions, so that's what we're about to do today. Okay, this is for NCLEX RN and NCLEX PN. Okay, this is for all nursing students. Does not matter your credentials. If you're about to take the NCLEX, whether it's the current NCLEX or the new NCLEX in April, this review is where you should be. All right, the content's not changing from NCLEX to NCLEX. The content's staying consistent. All right, you still need to know dosage count, pharmacology, maternity OB, fundamentals. All right. So how we're gonna play is just like you guys can see the screen right here, and thumbs up if you guys can see the screen. So I just want to just confirm that you guys can see it. It's not blurry. Thumbs up if you can see this. All right. And hear me. So how we're gonna play, it's just like regular Jeopardy style. You have your categories, and then you can have a certain amount of questions per category. For NCLEX Jeopardy, we have 5 categories, and we have 5 questions per category, each ranging from 100 points to 500 points. Okay, so this week's 5 categories, and they usually vary, all right, so we can cover all the content. But this week's 5 categories are dosage calculations, pharmacology, maternity OB, fundamentals, and then a special wild card category that's basically just going to be a mix and a surprise. It's a mystery. All right, so I'm going to pick one of those questions, and we're going to read the question. We're going to we don't have to read it together, all right? You don't have to wait for me to read it out loud, but when you see the question and you read it, when you're ready for the answer, just go ahead and just type the answer. But remember to say what is. This is Jeopardy style, so we have to answer it in Jeopardy style. So you have to answer it as a question. So you have to say what is, and then whatever the answer is. If the answer is like the third option, let's say the answer is 3, you would put what is 3. Okay, you don't have to type out the whole answer option. You don't. You just have to put just put the letter. So I get the gist of what answer you're actually saying, but you have to say what is. I actually need a pen. You have a pen over there? Just so I can have my handy dandy scoreboard. But whoever answers first and answers correctly in that what is style is going to be the winner of those points. Whoever has the most amount of points at the end of the game is going to win a free Ultimate Nursing School bundle. Thanks. All right. So, if you guys are ready to play, give me a thumbs up that you're ready for our first question. All right, I'm looking at what y'all saying. Y'all are voting for which one to do. I'm saying a lot of people saying wall card and stuff. That's fine. All right, give me a thumbs up if you guys are ready to play. All right, I'm gonna put my little thing right up here so y'all can see me, but also see the screen. All right, so let's go ahead and get into our first question. I'm getting thumbs up, letting me know that you guys are ready to get our review started. All right, if you know anybody that's in nursing school or maybe a new grad that is studying to take their NCLEX, whether it be RN or LPN, make sure you tag them. All right, they need to be at this review. All right, this is a great review, super fun, and you get free stuff. All right, let's go ahead and get into it. All right, so first question, let's do pharmacology for 100. Let's start it off real cute and real slow. All right, it says a client is receiving pyridium, aka phenazopridine hydrochloride, for a urinary tract infection. The client is receiving pyridium, aka phenazopridine hydrochloride, for a urinary tract infection. The client should be taught that the medication may what? A, cause diarrhea. B, change the color of her urine. C, cause mental confusion. Or D, cause changes in taste. All right. Now remember, we are playing for points. So if you want the points and if you want to be considered to get those points with the correct answer, make sure you say what is, and then you put your answer. If you just want to play for the review, that's totally fine. The more the merrier. But if you just want to play for the review and you don't want to get the points or be considered for the points, then just say the letter. Just give me your answer. Okay? All right, so I'm getting a lot of what is B's, which is change the color of her urine. All right, so we're either all correct or we're all wrong. So let's go ahead and see what our answer is for pharmacology for 100 points. And the answer is what is B. Look at y'all. Go ahead. All right, let me scroll all the way up to see who got it first. Okay, so according to my screen, by the way, I can only go by what's on my screen. All right, so if Julie answers on my screen before Mary does, then Julie's going to get the points, even if Mary answered first on your screen, because I can only see mine. All right, so let's go ahead and see who got these points, and the answer is tick-tock-tosh. Tick-tock-tosh. All right, congratulations, Tosh. You now have 100 points on the scoreboard. All right, we still have plenty of questions to go and plenty of opportunities for you guys to get on the scoreboard. So if you're not on it, that's perfectly fine. All right, but remember, this is just a fun way to get our content into practice, exposing ourselves to the NCLEX style questions. As long as you are getting the answer, getting the correct answer, whether you're first, second, whether you say what is or don't, as long as you get the correct answer, it means you're comprehending the content, which is what we want. All right, that's the whole goal. That's the real prize. Okay. So great job to everyone that said what is B, because I think that was literally everybody that said what is B. So awesome job. All right. Let's go ahead to go to the next question. Well, first, actually, I'm sorry. Let's read the rationale. Side notes. Whenever you are doing your practice tests, taking your practice exams, questions, whatever, when you're studying for whatever test, NCLEX, doesn't matter, make sure you are paying attention to the rationale of whatever practice test that you're doing. Okay, if it offers a rationale, take that as a double win. okay? Because not only are you getting exposed to the actual NCLEX style questions, so you can kind of get a feel of how they're going to ask the questions, but you're also getting like a mini review as well, so you can see the main point of this question, so that next time when you have the same content, you'll get the question right. All right, so it says, clients taking Peridium should be taught that the medication will turn the urine orange or red. It is not associated with diarrhea, mental confusion, or changes in taste. So therefore, those answers, A, C, and D, are incorrect. All right, special note, Peridium can also cause a yellowish color to skin and sclera if taken in large doses. Okay, sclera is the white of your eyes. So if you're taking, or if you have a client that's taking large doses of Peridium for like a UTI infection, it can also cause like that yellowish tint to sclera, which I can see that being a problem, because that can quickly be confused with what? You usually see yellowing of the sclera with what? Disorder. Yeah. Disease. Yeah, jaundice. There we go. Yes, jaundice. Jaundice is usually when you see yellowing to like skin or sclera, mucous membranes, you usually think of jaundice, which has to do with the liver. So that could be tricky. So make sure you guys know that Peridium can also cause a yellowish color to skin. Okay, I can see that being a question. I can. All right, next question. Let's do fundamentals for 300. And this looks like it cut off, so I'm going to read it to you. All right. Well, the numbers that are cut off, like it's just 1, 2, 3, and 4. Those are just the options. Okay, but I'm going to read to you what it says because it's a little bit cut off. I apologize. But the replay, it's not cut off, so that's weird. But okay. A client has been admitted to the hospital for urinary tract infection and dehydration. I promise UTIs are not like the theme. That's just coincidence, okay? The nurse determines that the client has received adequate volume replacement if the blood urea nitrogen, or the BUN level, drops to which value? Is it A, 3 milligrams per deciliter, B, 15, C, 29, or D, 35? All right. Make sure you guys go back and at least reread that last sentence of the question, so you can be reminded of what the question's actually and realistically asking you to answer. Okay? Just refresh your memory of what it is that you need to answer. All right? Client has received adequate volume replacement if the BUN level drops to what value? All right, I'm getting lots of people saying A, some people saying B, so it's really between A and B according to you guys. Some people are saying 3, some people are saying 15. Oh, thank you. She said my hair was pretty, y'all. All right, so I'm getting lots of A's and B's. All right, now I don't know how many of you guys are studying or preparing for, or I'm sorry, are projected to take the NCLEX after April 1st, 2023, because then you'll be taking the next generation NCLEX. And even though obviously this content is going to be consistent between the current NCLEX and the next one, the item format will be different. Okay, so whether you're studying for the next gen or even the current, always ask yourself why you chose an answer. Okay, just get into the habit of knowing in your mind, like at least having a good rationale or having a good reasoning why you chose what you chose. And if you're not saying it out loud, at least type it out. You know, say that you chose that the answer was A because of, you know, normal BUN is this to this. Have some reasoning. At least be aware of that reasoning, because on the actual next gen, they'll ask you what your reasoning is. Like, that will be half of the point, right? So just get into the habit of doing that, no matter if you're taking the current one or the next one. All right, now let's see what this answer is. All right, this is fundamentals for 300, and the answer is, what is B? 15 milligrams per deciliter. Hold on, let me go all the way back. All right, the answer is B. I'm scrolling back up through your comments to see who answered what is B first to receive these 300 points. And it looks like it is Nikki Cole 212. Nikki Cole 212. All right, Nikki Cole, you're on the scoreboard with 300 points. All right. TikTok Tosh, you still have 100, but like I said, it can be anybody's game. We still have plenty of questions for you to play, win those points, so someone can win that free Ultimate Nursing School bundle. All right, so it says the answer is B, 15 milligrams, and here's the rationale why. Now, if you did not get this answer correct, you probably want to take a little, notes of the rationale, so that once again, when you see this again, you won't get got twice. Okay, it says the normal BUN level is 6 to 20. I'm gonna pause right here. Okay, this says 6 to 20. I learned 10 to 20. Lab values are going to slightly vary depending on whatever lab that publication uses. Okay, that is one of the main reasons why on the next gen NCLEX, they're just going to give you the reference value. You still got to know the information, but they're just going to give you the reference value, just so we're all on the same page. They're just going to give it to you. Okay, but for the current, they won't give it to you. You still have to know. So whether you learned 10 to 20 or 6 to 20, usually the answer that they give you is going to be way outside of either parameter. So just in case that alarmed you. All right, so the normal BUN level is 6 to 20, 10 to 20, blah, blah, blah. Values of 29 and 35, all right, they reflect continued dehydration. All right, that BUN level is increased. When that BUN level is increased, that means something probably like, dehydration. There's some stress that's going on with the kidneys to where it's working a little bit harder than it should. And that can happen with dehydration. Okay, values of 3 milligrams reflects a lower than normal value, which may occur with fluid volume overload, among other conditions. Okay, so remember, the question asked you which lab value would indicate adequate fluid volume resuscitation or fluid volume replacement. So if you're looking for something that's adequate, or if you're looking for that, that's basically asking you to choose a lab finding that's within the normal range. All right, so whether you learn 6 to 20 or 10 to 20, 15 is still in the middle of both of those. All right, so that's what I mean when I say like the answer that they give you is going to be like either in the middle or on opposite sides of the spectrum. All right, so we all understand that one? Scroll back. Emily Podol said, if you guys need a little memory tip, this was really cute, Emily. She said 10 to 20 buns in the oven. Okay, that's how you remember it. 10 to 20 buns in the oven. Yeah, I love it. That is super cute. Let's see what you guys are saying. Mrs. Amina said, I learned 10 to 20, think of the price of... Mrs. Amina said, I learned 10 to 20, think of the price of a burger. $10 to $20. Hold on. Somebody asked. See, well, a lot of people said I learned 10 to 20. Yep. I currently have fun with advice. Celeste, my advice is always going to be to call, I don't know, don't call a physician, but give the acetaminophen some time to work. You only took it 20 minutes ago, give it some time to work. All right, guys, let's go back on. All right, cool. Y'all ready for the next question? Thumbs up if you're ready for the next question. No, it's not just you. When I uploaded the background, I guess this effect on TikTok is a little bit zoomed in, so they're a little cut off on the sides. But in the replay, which will be on YouTube, by the way, in the replay, it's perfectly fine. You see everything. But I understand that can be a little annoying. So I'm just going to read off whatever you can't see. All right, next question. All right, this is mental health for 200. The nurse is caring for a client diagnosed with paranoid personality disorder who is experiencing disturbed thought processes. In formulating a nursing plan of care, which best intervention should the nurse include? Remember to say what is if you want these points. All right. A, increase socialization of the client with peers. 2, avoid using a whisper voice in front of the client. 3, begin to educate the client about social supports in the community. Or 4, have the client sign a release of information to appropriate parties for assessment purposes. What is our answer? I'm seeing lots of B's. Seeing lots of B's. All right. So I don't know if you guys came to my mental health review that I had maybe like a month ago. But we did it was like a 2 to 3 hour long live where we reviewed mental health. But the difficult part about learning about mental health and trying to choose like interventions, you have to be, not only do you have to be wary about, the client's safety, your safety, everybody else's safety around you, but you also have to pay special attention to who it is you're talking to, okay? And not necessarily just like the client themselves, but, you know who you're talking to. And I mean that regarding their diagnosis, okay? Know mentally who you're talking to. If you have somebody that's diagnosed with paranoid personality disorder, how you talk to them is going to be completely different than how you talk to someone with bulimia, another mental health disorder. So you got to know who you're talking to when you're talking and choosing these interventions, okay? All right, so lots of people saying B. I do see some people saying D, though. I do see some people saying D. All right. Let me go ahead and get the answer while I am bringing up the answer for all my new comers that are just coming in. Hello, hello. Welcome to NCLEX Jeopardy. I am Nurse Sam, your host. We are doing a very fun and entertaining NCLEX Jeopardy review game. Okay, we do that live every Thursday. And hold on, I'm bringing up the answer. Yeah, it's just a great way to review for the NCLEX, for your classes. And we can do it in a group study session so we can all learn from each other. All right, so if you want to play, go ahead and jump in. We're playing for points. Make sure to say what is when you're answering. And I'm about to reveal the answer to this question right now, mental health for 200. So let's see who's going to win these 200 points. And the answer is, what is 2 or what is B? Avoid using a whisper voice in front of the clients. I want to ask y'all why y'all chose this answer. Remember, I want y'all to start thinking in terms of why you're choosing the interventions. Okay? Oh, Frank already answered me. Frank said, decrease stimuli because the client is already agitated. All right? Let's look and see what the, Nana said because they're paranoid. Period. The rationale says disturbed thought processes. Remember, that was a part of the scenario. Disturbed thought processes related to paranoid personality disorder are the client's problem, and the plan of care must address this problem. The client is distrustful and suspicious of others. All right, that's hence the paranoid personality disorder. That's usually what you see in people with that specific disorder. The members of the healthcare team need to establish a rapport and trust with the client. Okay, now laughing or whispering in front of the client would be counterproductive. Okay, I don't even have to have paranoid personality disorder, but if I'm around you and you're whispering and like looking at me, I'm gonna think you whispering about me, and it's gonna be an issue. Okay, so that was not gonna work anyway. So, but laughing or whispering in front of this client who does have paranoid personality disorder, you've asked for it. Don't do it. All right, it's counterproductive. It's not going to help you establish that rapport or trust. Now they're gonna further not trust you. Okay, the remaining options ask the client to trust in a multitude of levels. Right, these options are actions that are too intrusive for a client with this disorder. All right, you can't be too trusting because it's suspicious, and then you can't be just wild out here, just asking it, just saying anything to anybody, and laughing and whispering in people's faces. You just can't do that either. Okay. You want to prevent the patient not lose their trust by causing further solutions. Absolutely. Absolutely. All right, next question. Wait, no, I didn't see who got that one first. All right, so this was what is 2 or what is B? Hold on. First person to get this is Nana Felly. All right, Nana Felly, awesome job. You are now on the scoreboard with 200 points. So we have Nikki Cole with 300, Nana Felly with 200, and then TikTok Tash with 100. All right, we still got 30 more minutes to play, so it can be anybody's game. All right, and even if you're just here for the review, we have 30 minutes more review. Okay, awesome job. Next question. All right, farm for 500. This is a biggie. This is a big one. Farm for 500. A client begins to experience extrapyramidal side effects from an antipsychotic medication. The nurse anticipates that the primary healthcare provider will prescribe which medication to treat this condition. A, haloperidol. Tell me why, by the way. A, haloperidol. B, benztropine. C, chlorpromazine, or D, prochlorperazine. That looks the same. All right, so whatever your answer is, after you say it, tell me why. All right. Drea, you said what is A? Why? Luxie Gracie, you said what is B? Why? What rationale do you have? Or what's your reasoning behind choosing that answer? Why did you choose that answer? I'm gonna change and say what is 2. You know how I feel about changing answers, but we'll see. All right, all y'all saying what is A, but you're not telling me why. Why do you think that it's haloperidol? All right, let's revisit the actual scenario. All right, we have a client that's beginning to experience extrapyramidal side effects from an antipsychotic medication. Okay, the nurse anticipates / expects, so whatever, anticipates that the primary healthcare provider will prescribe which medication to treat this condition. So what will treat those extra pyramidal side effects caused by this antipsychotic? Y'all are saying B, benztropine. Some people are saying A, haloperidol. All right, you're saying to control the muscle movements. Someone said I chose B because I think haloperidol in choice C, which is chlorpromazine, can cause extrapyramidal side effects. B takes those away. All right, let's see what the answer is. Does it benching helps with muscle tone and decreases side effects? All right, let's see what the answer is. All right, so Farm for 500. Answer is, what is 2? Oh, snap. What is 2 or what is B? Benztropine. All right. It says benztropine is an anticholinergic medication that's used to treat drug-induced extrapyramidal reactions, except tardive dyskinesia. The remaining options are antipsychotic medications. And those antipsychotic medications can cause those extrapyramidal reactions. So that would just be compounding the same type of medication that caused it in the first place. So that was the key. That was the key to recognize the class, not necessarily the action, but really the class, because the class really identifies action. So. But yeah, to identify the class of those meds in those options to see which ones were which one was like an anticholinergic, and I noticed the trend of the other ones being antipsychotics. Okay, hold on, let's see who got this one first. What is B? Smell and Adam. Is it Smell and Adam? Great job, Smell and Adam. Woohoo! You have 500 points. Ahead of the game and ahead of the curve. Great job. Y'all see what I mean when I say it could be anyone's game? You just you never know when it's about to be like a 500 pointer. You know, somebody gets that, they in the lead. You know. But like I said, on the actual NCLEX, it's not going to be point style. It's not going to be game show style. You know, you're not going to see other people's answers to either put you on or dissuade you. You're not going to see that. This is just my way of delivering the same content, boring content to you guys, but just in a fun way that would actually make learning fun and therefore more effective. Okay, I like to call these my little study parties, okay, which I was famous for in nursing school. Study parties, or they would come over to my house and we would order pizza and study the entire night. But this is my digital version. All right, so great job to everyone that said what is B. All right. Tiffany said NCLEX is not this easy. Oh, did you take NCLEX, love? All right, these are NCLEX style questions. Okay, now remember, for the NCLEX, you take between I think 75 to 145 questions, I believe, and those are based on your performance, the questions that you get. All right, the delivery system that they use is called CAT, or computer adaptive testing, which basically means the questions that you get, they all depend on how you do on the other questions. So if you answer a question and how you do on this one will determine the next one that you get, and so on and so forth. So some people's NCLEX may be easy, some people's may be harder, but these are NCLEX style questions for you guys to get used to, because even with this one, people got it wrong. So ooh, thank you, Natural Sunshine. All right, guys, let's do the next one. Why isn't it just standardized? Okay, I have no idea. All right, guys, let's go ahead and go to the next question. good. I'm glad you took it, and I'm glad it was easy or hard for you. I'm not sure, but I'm glad you think this question was easy. That means you understand the content. Awesome job. All right, next question. This is farm for 400. All right, farm for 400. All right, like I said, I apologize about it cutting off a few of the words, so I'm gonna read it through. This is isotretinoin. That's the first word, isotretinoin. All right, this says isotretinoin is prescribed for a client with severe cystic acne. The nurse provides instructions to the client regarding administration of the medication. Which phrase stated by the client indicates a need for further teaching regarding this medication? 1, I need to continue to take my vitamin A supplements. 2, the medication may cause dryness and burning in my eyes. 3, I need to use emollients, I don't know how to say that right, and lip balms for my dry skin and lips. Or 4, I will need to return for a blood test to check my triglyceride level. What is our answer? Remember to go back and read at least that last sentence. So which phrase stated by the client indicates a need for further teaching regarding this medication? Okay, remember, whenever you see a need for further teaching, you are looking for the statement that is incorrect. All right, if a statement needs further teaching, that means that they said a statement that was not correct. it was not actual factual. So they clearly just need a little bit more coaching, teaching, education, because they don't grasp the concept yet. So that's what that means. So you always want to make sure when you're going through each answer choice, so you don't lose where you're going in your mind, you ask yourself, is this true or false? All right, I need to continue to take my vitamin A supplements. Is this true or false? Okay, and if it's true, you know that's not the answer that you're looking for, because you're looking for a false statement. So as you do that through each answer choice, that's how you can find your answer. All right. Let's see what y'all saying. I was trying to be negative. I know you. See, you were trying to be negative. I know you were. That's why I made it into a positive, because you're not gonna rain on our parade, sis. All right. Yay. All right, I'm looking to see what you guys are saying. You're saying, okay. You guys are saying, I see vitamin A. Oh, wait, I'm sorry. I see answer A. I'm seeing B and D. A, B, and D, actually. I'm seeing lots of those. Ooh, A, B, and D. Y'all are like, this is really, and I see a C too. Wow. A, B, C, or D, which one? All right, now this, I need y'all to tell me why y'all answered what y'all answered. It was, I love the hair, by the way. Thank you so much. The curly is gone. Oh, sorry. Tiffy said I wasn't trying to be negative, typo. Okay, gotcha. Vitamin A increases the side effects. Okay. Vitamin A increases the side effects, or the levels of vitamin A, which causes those side effects. Okay, I feel you. All right, let's look and see what our answer is. Farm for 400? All right, so we're looking for that false statement about isotretinoin. The answer is what is 1, or A. I need to continue to take my vitamin A supplements. All right. It says, on severe cystic acne, I was like, what does that say? On severe cystic acne, isotretinoin is used to inhibit inflammation. Adverse effects include elevated triglyceride levels, skin dryness, eye discomfort such as dryness and burning, and cheilitis, aka lip inflammation. All right, close medical follow-up is required, and dry skin and cheilitis can be decreased by the use of emollients and lip balms. Okay, vitamin A supplements are stopped during this treatment. Okay, so remember, isotretinoin is a vitamin A derivative, and if you already have vitamin A and then you're taking vitamin A supplements, you're now like compounding that effect. I forgot what it's called. There's a word for it. Where it like, dang it, what's the word I'm looking for? Where the side effects kind of like, y'all know what I'm trying to say. What is it? Additive. Thank you. It's an additive effect. So yeah, they compound on each other, and increase the chances of those adverse effects. So that's why you would stop those treatments. Okay. Now remember, it said it was looking for a need for further teaching. So if you know that the right thing to do is to stop the vitamin A supplements, but then someone says, oh, okay, so I'm gonna continue taking my vitamin A supplements, that's the statement that you should be like, this isn't accurate. Let's go through this module again, love bug, it's fine. So yes, that's what you would do. Synergistic. Thank y'all. Y'all know what I be meaning. Thank y'all so much. All right, so who got this one? This was what is A? Let's see who got what is A first. What is A? It was actually Tiffany Howe Sam. Tiffany House Sam, awesome. Okay, so I'm glad we've established that you weren't trying to be negative. Okay, this is our sister circle, and we will, be honest, let you know it did kind of come off that way, but you said that's not what you meant. So cool, water under the bridge. Tiffany House Sam. Tiffany House Sam. You now have 400 points. All right. So, Smell and Adam, you're still in first place with 500. Then we have Tiffany with 400. Nikki Cole with 300. Nana Felly with 200. And TikTok Tash with 100. All right. We still have some questions to go. All right. It's not 8 o'clock yet. So, we are definitely going to keep doing our questions. All right. If it's anything that you guys don't understand, make sure you are, utilizing this time and either asking me or just typing the questions. If I know it, I will definitely tell y'all. If somebody else maybe knows the answer, they'll answer it. But I would love to help you with this. Help me with what? No, it says sister circle. Right, period. So I'm looking at what y'all saying. Okay, awesome. I've been a nurse for 25 years. I'd love to help you with this. Thank you. Help me with what? All right, guys. Next question. Oh, man. Okay, here we go. All right. What's this? Ooh, dosage calculations. Dosage calculations, guys. This is dosage calc for 300. Yep, 300. All right. Now, this is a fill in the blank. Okay. This is a fill in the blank. And this is a current NCLEX style question. All right. This says, the intravenous prescription is 1,000 milliliters of 0.9% sodium chloride, aka normal saline, to run over 12 hours. Hey, Shampoo Poppy, what's up? The drop factor is 15 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute? Record the answer to the nearest whole number. blank drops per minute. Make sure you say what is if you want these points. If you just want the review, then just say a number. But remember, it's round to the nearest whole number. Okay, y'all remember y'all rounding rules? We're gonna go over it just in case. But yeah, total. Awesome. All right. So I'm seeing lots of 21s, but I'm seeing 20s as well. I'm seeing 20s and 21s. So that lets me know that we need to take a little look at our rounding. Remember our rounding rules, okay? If we're rounding to the nearest whole number, remember when we're supposed to round up and when we're supposed to round down, okay? All right, let's go ahead and see what our answer is. What is 21 drops per minute? 21 drops per minute. All right, so this is a Dosha's calculations question. On the current NCLEX, you still have, I guess, that alternate item types. You still have alternate item types, and one of those is definitely fill in the blank. Now, in the current NCLEX, you usually only see fill in the blanks with like a numerical question. Usually that's something, pharmacology / Dosha's calculations related. Those are the fill in the blanks, just like the one we just had, that you're expected to see. Now, on the next gen NCLEX, that's a different concept for different names, but we won't talk about that. But yes, let's go ahead and work this out. Y'all pretty much said the correct answers, but like I said, the rounding is what really got everybody. All right, so for this, we're going to calculate drop factor. All right, so we have to know our formula for how to calculate that. And that is total volume times the drop factor over the time in minutes. And that's going to give us drops per minute. Okay, now all we do now is plug and play. Okay, in the clinical scenario, they gave us those values. So now we're just going to plug them into whatever appropriate place they're supposed to be in the formula and get our answer. All right, so remember our total volume of our IV solution, we had normal saline 1,000 milliliters. All right, so that's going to be our V. So we have 1,000 milliliters times, it says the drop factor. It gave us what the drop factor was. It was 15. So we're going to put 15 GTT, which is drop. That's the abbreviation for drop, by the way, GTT. And then it's going to be over time in minutes. All right, the time in minutes. So what they gave us was this was supposed to run over 12 hours. So you would convert the 12 hours into X amount of minutes. All right, you already know that there are 60 minutes in 1 hour. If we have 12 of those hours, we're just going to multiply 60 by 12 to get 720 minutes. All right, so now we have each of those placeholders filled for our drop factor formula. All right, so we're going to multiply straight across. 1,000 times 15 is 15,000. Now we're going to divide. All right, 15,000 divided by the 720 minutes. That's going to give us 20.8. But remember, it said to round to the nearest whole number. And usually when you're doing drop factor, you're always going to round to the nearest whole number because you can't have like a fraction of a drop. All right, it's either a whole drop or no drop, So for this, we're going to know our rounding rules. Remember, if it is 5, if the placeholder, if the placeholder to the right of the number that's being rounded, if that is 5 and above, we're going to go high. Okay, we're going to round up. If it is 4 or lower, we're going to go low. All right, so 5 and above, we're going to go high. We're going to round to the nearest whole number, so that's going to round up. 4 and down, rounding down. So 20.8, that 8 is the number that we're looking at. So is that 5 and above or 4 and below? It's 8, so it's 5 and above. So we're actually going to round 20.8 up to 21. So our answer is 21 drops per minute. So you would type in 21, and that would be your answer, and it would have been correct. Alrighty. What are y'all saying? Okay, future years don't want the points. Got you. 21. All right, so let me scroll up and see who got this one. Future Earnest does not want the points, hence she didn't say 21. So the next one is Tiffany. All right, Tiffany, you're on the scoreboard already with 400, so you just got another 300 added to your score. So now you have a score of 700 points. All right, awesome job to everyone that got 21. Awesome, no problem. All right, guys, last question. All right, ready? This is maternity for 200. Maternity for 200 is our last question. All right, it says the nurse is describing the process of fetal circulation to a client during a prenatal visit. The nurse should tell the client that fetal circulation consists of which components? A, 2 umbilical veins and 1 umbilical artery. B, 2 umbilical arteries and 1 umbilical vein. C, arteries that carry oxygenated blood to the fetus. Or D, veins that carry deoxygenated blood to the fetus. The nurse should tell the client that fetal circulation consists of which components? All right. I'm not sure if you guys have taken maternity yet. If not, give it your best guess. Give it your best guess so that when you do go take maternity and you see this question, be like, oh, I learned this with Nurse Sam 2 semesters ago. Get on my level. All right, I'm getting lots of B's. People saying 2 umbilical arteries and 1 umbilical vein. Someone said C. Someone said A. All right. Somebody said C. All right, let's go ahead and see what our answer is. And the answer is what is 2 or what is B? 2 umbilical arteries and 1 umbilical vein. All right. I remember saying something. I didn't remember this. Baby Ava. Baby Ava is how you can remember this. Baby Ava. So AVA, 2 A's and a V, 2 arteries and a vein. Baby Ava. All right, so rationale says blood pumped by the fetus's heart leaves the fetus through 2 umbilical arteries. After the blood is oxygenated, it is then returned by 1 umbilical vein. The umbilical arteries carry deoxygenated blood and waste products from the fetus. Remember, arteries usually carry away, right? And the umbilical vein carries oxygenated blood and provides oxygen and nutrients to the fetus. Walking into maternity like I know something like, that's exactly how you're gonna walk into maternity. Tiffany said, two artists in one vein in the umbilical cord. You can make a smiley face out of it to remember. Like A, and then B, like that. Oop, boop, 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 boop. Oh no, I am the ambitious one. You take your NCLEX on Tuesday. Oh my gosh, you are so close. Breathe. Just breathe. You got this. It's the anxiety that you're feeling is normal, I promise. Like, you're definitely going to freak out. But that's just because you have been preparing for this for a very long time. This is it. This is the final game. So that anxiety is normal. You just can't sit in it. You have to do something. Whether it's like go to the movies, watch a movie, go out with some friends, something. Study if you want to, except for the night before. So Monday night, I don't want to see you pick up no book. Okay? All right, I'm scrolling to see who got this answer correct first. And it was TikTok Tash. Or Tosh. TikTok Tosh. All right, love, you already have 100 points, so you just got another 200 added. So you have 300 points. All right, and since that concluded our game, and this is our scoreboard, I can go ahead and rally up our scores to see who our first place winner is. And the person with the most amount of points, with a total of 700 points, all right, was Tiffany. Is it Howie Sam? Tiffany Howe Sam. Yep, Tiffany Howe Sam. So awesome job. Woohoo. All right. Smelling Adam was right behind with 500. And then Nicole TikTok Tash with 300. And then Nana Belly with 200. Great job to everyone that played. Great job to everyone that placed and was on the actual scoreboard. But like I said, that was just, some friendly competition for us, just to make it a little bit more fun than, panic attacks when it comes to preparing for the NCLEX. Just like I'm the ambitious one was just saying. So it's just a way to get you guys to still do your review, still put that effort in, put that work in without, wanting to go and cry in the corner every time you get something wrong, So that was tonight's session of those questions. Tiffany, congratulations again. You have won an Ultimate Nursing School bundle. Okay, now the questions that we do here, like I said, we only do an hour worth, so that ends up being like 5 to 8 questions or something. If you want to play the full 25 questions, 5 categories and 5 questions per category, 25 new questions. If you want to play the 25 questions, you can go ahead and download the Nurse Sam app, which is free to download for iOS and Android. And when you open that free app, you're going to go to NCLEX Jeopardy, which is mobile exclusive. You cannot get that on your computer. You cannot log into that on anything except accessing it through the app. Okay? So it's free to download and free to play. All right? 25 new NCLEX style questions every week. All right? A great way for you to study, especially if you A, don't have the funds to get those practice questions, or B, just want some, studying on the go. Just be like, what, let me just test myself really quick, and you're at a basketball game or something. I don't know. But yeah, it's great for on the go studying. At your fingertips, you get to control it instead of just waiting for me. And if you guys wanted that kind of guided version of the NCLEX Jeopardy, if you want to watch any of these replays, we have over 100 replays on our YouTube channel that we just put up not too long ago. So go ahead and subscribe to my YouTube channel at the Nurse Sam TV. Yep, at the Nurse Sam TV. Subscribe to my YouTube for NCLEX Jeopardy replays, reviews, NCLEX reviews, pretty much anything that you'll need within nursing school and as you prepare to take and pass the NCLEX. All right. So the app is called the Nurse Sam. All right, if you go to the link in my bio, you'll be able to just click the link where it says download the app, and it'll take you to wherever you need to go for your device that you're on. All right, so Tiffany, once again, congrats again, you won first place. I'm not sure if you have Instagram, but I'm hoping you do, just because DMs don't really work on this. But I just need your full name and I need your email address so I can go ahead and send you our 400-page bestseller. All right, this is normally $97. We just had a Black Friday 80% off sale that ended yesterday. So, now everyone's trying to get it for final time, and you just got it for free. So yay. It covers, like I said, it's 400 pages of study material, study content, as well as some NCLEX content, as well as some strategies ranging from fundamentals, farm, dosage calc, IV therapy, mental health, maternity, all those, okay? And just like I made this fun, I make studying fun by making all of my study guides like a fun, entertaining theme. Like IV therapy is like Beyonce themed because it reminded me of Ivy Park. Dosage calculations is Monopoly themed because the math just reminded me of Monopoly. Fundamentals reminded me of Rugrats, so I made it like a Rugrats theme. So it's just different themed study guides to make studying fun and to help you really retain the material and the information that you're reading. All right. Website is thenursesam.com. Okay, I think we're gonna do it. Yep, DM me on IG, Tiffany, so I can get your name and your email so I can send that to you. All right, I'm saying congratulations. I'm the ambitious one because you take it on Tuesday, which means Wednesday, Thursday is probably when you'll get your decision. So I fully expect to go ahead and tell you congratulations on Thursday because I know you're going to rock this NCLEX. Girl, you're about to rock it. I am the ambitious one that has been coming to NCLEX Jeopardy faithfully for I don't even know how long, to be honest. I don't even know how long. Just as much as you kill it in NCLEX Jeopardy, you don't have anything to worry about. Besides just normal nerves, you don't have anything to worry about. You have done your due diligence. I have been a witness. Okay? I really appreciate your help. You're great. Oh, thank you guys so much. All right. So if anybody else is taking their NCLEX soon, but if anybody else is taking their NCLEX soon, good luck to you. I'm so proud of you. I'm going to say that now because I know you're going to kill it. Period. All right, guys. That is pretty much it. So thank you so much. You're welcome, love. All right, guys. I will see y'all next time. We're going to be right here next week. Same time, same place for NCLEX Jeopardy for a new set of questions and a new set of categories for our fun review for NCLEX. LPN and PN and RN. All right? Everyone's invited. If you're a nursing student, you're invited. All right, y'all. I will see y'all later. And thanks so much. Bye.